channel. I'm Yassy
and I'm Lolo.
and together we are
Yassy and
Yassy&Lorlor. So today we are talking about sickle cell anemia or sickle cell disease.
Yeah. So first of all, we're going to start with genotypes. Genotypes are the complete genetic makeup of an individual. I mean complete. One can get its genotype from their parents, the mother and the father. So there are 4 genotypes. We have the AA, the AS, the SS, and AC. AC is very uncommon. It has the sickle cell trait, but they don't normally have complications. They may experience certain symptoms, slight symptoms, but they never have crisis. So I can say it is wrong for an AC female to get married to an AC male. There are going to be complications. So this is just an introduction. We're going to move forward and explain further the reasons why we are supposed to know our genotype and the people we are supposed to get married to, the people that we are not supposed to get married to be on the safer side and to avoid complications in the near future, to prevent having children who are going to suffer their whole life, and to prevent you from suffering as well and spending lots of money and going to the hospital back and forth all the time. So this video is just for you to prevent sickle cell disease or sickle cell anemia, sickle cell crisis, everything. So yeah,
Stay tuned. Okay, so sickle cell anemia is a group of inherited disorders that is also called sickle cell disease.
Yeah.
And it affects the shape of the red blood cell. So instead of it looking like the normal circle waves, it begins to look like the shape of a moon.
Yeah,
And then it's the blood becomes thick,
and the cells get sticky.
Yes.
So yeah, the cells become sticky and they get stuck in your blood vessels, preventing the blood to flow very well in your system. In this case, the patient tends to suffer from severe pains because the blood is not allowed to flow well due to how stuck the red blood cells become. And this thing comes about when one is on a very high altitude, when the temperature is very cold, temperature is very high, or the person is dehydrated, the person is stressed. When one is dehydrated, it means that there's not enough fluid, and we are allowed to take in so much fluid to help our blood circulate very well. So if you are lacking, if you know you are a sickle cell patient and you are lacking enough fluid, you should try and take in more fluid to help your blood flow to prevent crisis. So for one to get a sickle cell gene, there is a woman and there is a man. So when man and woman come together, they give birth to a child, a zygote. Yeah, right. So when one has a genotype of, let's say, AA, and the man has a genotype of AA, and the woman has a genotype of AS, they will have children AA, AS, AA, AS. Yeah, it makes sense. So the AS is a very severe form of a gene that has the sickle kind of that has a sickle disease. So if the child inherits S from the mother and inherits A from the mother, the person could have symptoms but won't have the crisis. But unfortunately for one, if the mother has SS and the man also has SS, when they meet, they're going to have a child, definitely going to have a child with SS. And S is a very severe form of gene that is a disease. So the child is going to suffer their whole life. So there is a way of preventing this disease. So when you meet a man and you are so much in love, you should ask the man, what's the genotype? When you meet a female and the person you're so much in love with the female, you should also ask the female, what's your genotype, to prevent all these crises, to prevent the SS from coming in, to prevent the AC, to prevent the AS, prevent all these from happening. So for you to prevent this, you have to know your partner's genotype. You get it?
And to know, you just visit the hospital. If you don't know already, just visit the hospital and take your test. It's going to include your blood group and then the genotype.
Yeah.
So some symptoms of sickle cell disease is anemia. So once you have the sickle cell disease, there's a high possibility of you being anemic. You're not going to have enough blood. Another point is that there are going to be episodes of pain, as in joint pains, because the blood is not circulating properly to and fro in your body. Another symptom is that your feet and your hands swell. So because of the blood retention, then your feet becomes a little bit big. That's how, and then your hand also becomes big. When you touch it, it's like it goes in. It doesn't look like the normal way. That's also another symptom. And then there's also frequent infection. The least thing, you have the infections, the pneumonia, and so on and so forth. So the next one is delayed growth and puberty. So when you have sickle cell anemia or disease, you are retarded in growth, and then your puberty process is delayed in terms of your menstruation cycle and all of that. The blood is what helps you as an individual. It adds up in your growth process. So when the disease is feeding up in your body, it retards your growth. The last point is vision problem. So you begin to have problems with your sight.
There are factors that brings about sickle crisis. That's high altitudes. When you're like places that are very high altitude, that when where you are, they are very cold temperatures, you tend to have crisis, because when it's cold, the blood are not allowed to flow well. Already your red blood cell shapes are not in a normal way, they are abnormal, so the blood, it gets stuck, then they are not able to flow well. And when you are stressed, you can have crisis. When you are dehydrated, because intake of fluid helps the blood to flow well. So when you are dehydrated, it causes the crisis. Also, when there is like a traumatic event and you tend to lose a lot of blood, there's a possibility of you having crisis. Last point is illness. When you are not feeling well, a sickle cell patient mostly fall sick, especially when they get infection and all. They have crisis a lot. So so there are ways of preventing the crisis. In a situation whereby you are a sickle cell patient, you should prevent a cold weather from getting to you. When you are in the cold weather, you put on clothes that can cover you enough to prevent you from getting cold. Prevent high altitudes. Try your possible best to be hydrated, taking enough fluids. Don't stress yourself so much. Don't do vigorous exercises. You can exercise though, but not vigorously. You reduce it in a way that won't make you feel so stressed. Also, you're supposed to try your possible best to prevent infections. Infection tends to bring out crisis in a sickle cell patient. And please eat vegetables and fruits. Fruits rich in protein, vitamin C, iron, like plantain, kontomire, to help build up your blood volume.
So some complications of sickle cell disease, one includes some acute chest pain. You are there and then suddenly you feel this pain in your chest, is so sharp, it's so nothing. That's it. Okay, another one is stroke, blindness, leg ulcer, pregnancy complications, and so on and so forth.
So many complications. So you should take care of yourself.
So another preventive factor is that you can talk to a counselor who is into this sickle cell diseases. They're going to teach you some preventive measures, and also you have to also see your doctor. And also, before you have any sexual encounter with your partner, ensure you know their genotype
Very, very important.
before you make a baby.
Yeah. Okay, let's take good care of ourselves before we plan to get married. Let's check our genotypes to save ourselves from all this stress. From all these, it's very stressful. Okay, so let's take good care of ourselves. Let's try to cover ourselves. Thanks for watching. Please, let's like and share. Subscribe, okay? Thank you very, very much.
We want 1,000 likes this year, 2023. 1,000 likes, and 1,000 views. So share for us and subscribe.
Thank you. Adios.